Welcome to the Dental podcast.
Glad to be here for this one.
Yeah, so imagine spending, I don't know, 3 years and thousands of dollars building this brilliant architectural masterpiece, right? Only to let the foundation just completely rot away before the ribbon cutting ceremony.
Right, which would be a total disaster.
Exactly. And if you or maybe your kid currently have a mouth full of orthodontic metal, that is the exact risk you run every single time you sit down to eat.
Every single meal.
Yeah. So welcome to today's deep dive. Our mission today is to unpack this really fascinating stack of resources we got, focusing on the best tips for oral care during braces treatment.
It's a really comprehensive guide.
It is, yeah. Specifically, we're looking at an April 3, 2026 survival guide, and it was written by Dr. Bilis Poles. And we're also going to look at his practice, which is OmniDental and MedSpa, which operates in a way that might honestly completely change how you view a trip to the dentist.
Oh, absolutely. I mean, the home renovation analogy you just brought up is incredibly fitting for what Dr. Poles outlines in this guide.
Right.
Because you are basically installing semi-permanent architecture into a volatile biological environment.
That's a great way to put it.
Yeah. You have the blueprints and the final structurally sound result is going to be beautiful. But the middle phase, it's a messy, complicated construction site right in the middle of your face.
Right in your mouth.
Exactly.
Yeah.
There's scaffolding everywhere. The rules of daily maintenance just change completely the second those brackets and wires are glued on.
And if you don't have the right daily cleanup crew, that construction site deteriorates rapidly.
Fast. Like, very fast.
Which brings us to the foundation of that cleanup, right? The daily brushing routine. The guide from Dr. Poles is, well, it's incredibly strict about the geometry of brushing.
Very specific about it.
Yeah, it insists on holding the toothbrush at a very specific 45-degree angle. So, okay, let's unpack this. I'm looking at my own morning routine, and I'm usually in a rush, right? Just scrubbing face-to-face on autopilot. Why exactly 45 degrees? Like, if I'm in a rush, does brushing straight on really do that much damage? Or is that just dentists being, perfectionists?
Well, what's fascinating here is that the focus on geometry comes down to the microscopic physical barriers that braces create.
Okay.
So imagine the bracket glued to the center of your tooth. It essentially creates a tiny protruding ledge.
Right, like a little shelf.
Exactly, little shelf.
Yeah.
If you brush straight on, the way you naturally would without hardware, the bristles of your brush are simply polishing the front metal face of the bracket.
Oh, wow. So you're just cleaning the metal.
Right. You're shining the scaffolding while entirely ignoring the actual biological building underneath. The real danger zone is that microscopic shelf where the bracket meets the tooth enamel, both on the top edge and the bottom edge.
Because that's where stuff gets stuck.
Yeah, because plaque is an acidic biofilm. If it just sits on that tiny shelf, it begins to rapidly decalcify the tooth.
Oh, so that's how you end up with those permanent, chalky, white, square scars around where the bracket used to be, like when they finally take the braces off.
That is the exact decalcification process in action.
Yeah. Yikes.
Right. But by tilting the brush to a 45-degree angle, you actually force the bristles to slide under the arch wire and sweep out that tiny crevice between the bracket and the gum line.
That makes total sense.
Yeah, you attack the plaque from above the bracket, and then you flip the angle to sweep from below.
Well, and that structural reality also explains why the guide mandates a soft-bristled brush. Which is funny because my instinct would be to reach for, the hardest bristles possible.
Most people's instinct is exactly that.
Right, because if I have a dirty tile floor, I want a stiff scrub brush to really aggressively get the grime out.
Oh, for sure. But
Yeah.
applying that stiff brush logic to orthodontic hardware is a complete recipe for broken appliances.
Really? Just from brushing?
Yeah, because hard bristles simply do not possess the flexibility to bend and curve into those 45-degree micro crevices. They just bounce off.
Oh, I see.
And furthermore, aggressive brushing with stiff nylon over metal brackets actually causes microscopic scratching on the enamel surface.
Wait, you scratch your own teeth?
Exactly. You are essentially carving out fresh microscopic canyons for bacteria to hide in.
That sounds terrible.
It is. Soft bristles, on the other hand, they flex under pressure, allowing them to gently sweep the ledges without acting like an abrasive scouring pad.
Got it. Okay, the guide also emphasizes brushing after every single meal, not just your standard morning and night routine, which I guess makes sense when you consider the hardware blocks your mouth's natural defense mechanism.
Oh, entirely.
Yeah, because without braces, your saliva constantly washes over the flat surfaces of your teeth to, clear away minor food debris. But with a mouthful of metal traps, that natural self-cleaning system is completely disrupted.
It's totally offline.
Right, so every meal introduces new debris into the site, meaning your toothbrush is going to take a beating.
Exactly. Because of that increased friction and frequency, those soft bristles will fray and bend out of shape much faster than normal.
You go through them quicker.
Way quicker. Dr. Polz's guide actually makes it a non-negotiable rule to replace that toothbrush every 3 months, or literally the very moment the bristles begin to look splayed out.
Makes sense.
Because a frayed brush is functionally useless for hitting those precise 45-degree angles.
Okay, so we have the surface architecture sorted out. We're angling the soft brush. We are clearing the ledges. But the toothbrush is ultimately just handling the visible terrain, right? The guide is very clear that the real insidious dangers hide deeper, specifically under the wire.
The deep clean.
The deep clean, exactly.
Yeah.
Dr. Polz requires daily flossing, but he introduces specific tools called floss threaders, along with interdental brushes and finishing everything off with a fluoride mouthwash.
And honestly, flossing is this stage where a lot of people just throw their hands up in frustration and abandon the routine altogether.
Oh, I can completely understand why. I mean, reading the instructions for a floss threader, it feels like trying to thread a tiny wet needle while staring backward into a foggy bathroom mirror.
It's quite the visual.
Right. My immediate thought is, is regular flossing really impossible with braces? Can't I just muscle my way through? Can't you just force it down from the top like normal?
I get that, but the physical reality of the arch wire makes that basically impossible.
Because of the wire itself.
Right. The arch wire is that continuous metal track that connects every single bracket horizontally across your teeth.
Yeah.
It's a solid steel or nickel titanium barrier. If you attempt to force normal floss down from the top, you immediately hit that track.
Right, you just get stuck.
And if you apply excessive downward pressure trying to bypass it, you run the very real risk of bowing or entirely snapping the arch wire, which creates a huge emergency situation.
Ouch. So you are essentially trying to push a rope through a steel beam.
Through a steel beam, exactly. The floss threader is the elegant workaround to that physical barrier.
Okay.
It looks like a flexible plastic needle with a large loop. You thread your standard floss through the loop, and then you pilot the stiff plastic tip horizontally underneath the arch wire.
Oh, under it.
Underneath it, yeah. Right in the gap between your teeth near the gum line. Once you pull it through, you've successfully bypassed the wire, and you can slide the floss up and down the sides of the tooth normally.
And then you take it out and do the next one.
You pull it out and repeat that pilot process for the next gap.
I mean, it is undeniably tedious. You have to do that entire sequence for every single space in your mouth.
The tedium is very real. But the guide highlights skipping this step as literally a common mistake. And it's the most dangerous pitfall of orthodontic care.
Because of the cavities.
Exactly. A toothbrush simply cannot reach the contact points between the teeth. If that interdental plaque is left undisturbed for 2 years, the bacteria secrete acid continuously.
Wow. 2 years of acid.
You could endure years of orthodontic adjustments, only to unveil perfectly straight teeth that are structurally hollowed out by cavities at every single contact point.
A beautifully straight disaster.
Exactly.
Yikes. Well, the guide also brings in another tool to prevent that. The interdental brush, or I guess some people call it a proxibrush. If the floss threader is the needle and thread, this interdental brush seems to function more like a microbroom.
That's a great analogy.
It's this tiny cone-shaped bristle brush designed specifically to fit where normal tools fail.
Right, because the architecture of braces creates dead zones behind the arch wire, right between the brackets.
Where the toothbrush just can't reach.
Exactly. The interdental brush is engineered to slide vertically behind that wire. You basically sweep it up and down to dislodge anything trapped directly against the enamel that the 45-degree toothbrush sweeps missed.
Nice. So once you've mechanically swept the site with the toothbrush, the floss, and the microbroom, you need to flush the debris out. The guide specifies using a fluoride mouthwash after meals. So you're using a liquid sweep to physically wash all the dislodged food particles out of the complex hardware. But there's a secondary chemical benefit there too, right?
Oh, definitely. The mechanical sweeping removes the bulk of the thread, but microscopic bacteria always remain.
Right, you can't get everything.
Exactly. So the mouthwash provides chemical flush, and more importantly, the fluoride in the wash actively binds to your tooth enamel.
Oh, it actually binds to it.
Yeah, it remineralizes the surface. It hardens the structural walls of the teeth against the acidic byproducts of whatever bacteria managed to survive that mechanical cleaning.
That's amazing. But I guess you can have the most robust chemical and mechanical defense system in the world. But if you load the construction site with concrete and superglue, all those brooms and fluoride washes are completely useless.
Pretty much.
Which brings us to defensive driving for your mouth. The lifestyle and diet choices. Dr. Poles provides a very clear roster of foods to avoid. We're talking sticky foods like caramel and gummies, hard foods like popcorn kernels, hard candies, chewy things like taffy.
All the fun stuff, basically.
Right, and the fundamental solution here is transitioning to softer foods and meticulously cutting your meals into smaller, manageable pieces rather than just, biting into things whole.
Well, it is really about reducing sheer physical force on the brackets.
Mm.
The glue holding them onto your teeth is strong, but it is actually designed to eventually be broken off by the dentist.
Oh, right, they have to come off eventually.
Exactly. So a stray popcorn kernel provides the exact right leverage to pop that glue prematurely.
And here's where it gets really interesting to me. The guide specifically calls out mindless bad habits. Chewing on ice or chewing on pens. Now, I chew on my pen cap at my desk all the time when I'm deep in thought.
A lot of people do.
Yeah. But the guide warns that breaking a bracket by doing this can actually cause delays in your overarching orthodontic timeline. Which, I always assumed a broken bracket was just kind of a minor aesthetic annoyance.
Oh, no.
Right, like the tooth just stays in its current spot until you get it glued back on, right?
Yeah.
How does a broken bracket actually delay the whole process?
Well, if we connect this to the bigger picture, to understand the delay, we really have to look at the biological mechanism of how teeth actually move through solid bone.
Okay.
Orthodontics relies entirely on the principle of constant calculated tension.
Constant tension, got it.
The brackets and wires are engineered to apply a very precise, continuous microscopic force to the periodontal ligaments surrounding the tooth root.
That sounds intense.
It is. This constant pressure triggers a biological response. Specialized cells called osteoclasts break down the jawbone in the direction the tooth is moving.
It's literally breaking the bone down.
Yes, and at the same time, osteoblasts build new bone behind it to fill the gap.
So it's a continuous closed system of pressure driving bone remodeling.
Exactly. But the key word there is continuous. This cellular remodeling only happens if the tension is 24/7.
Oh, I see where this is going.
Right. When you mindlessly crunch on a plastic pen cap and snap a bracket off the enamel, or even just bend an arch wire out of its bracket slot, you instantly sever that tension.
Boom. Tension gone.
The physical force drops to absolute zero for that specific tooth, and honestly, often for the entire quadrants of your mouth.
The system completely depressurizes.
The cellular remodeling halts immediately.
Yeah.
Your treatment progress is paused from the second that bracket pops. But it gets worse.
Worse? How?
Because the periodontal ligaments are elastic. They naturally want to pull the tooth back to its original familiar position in the mouth.
Oh, no way.
Yeah, this is called relapse. So if you wait 2 weeks for your next available appointment, you aren't just pausing the clock. The tooth is actively drifting backward.
So you're losing ground.
You lose the 2 weeks of waiting, plus the weeks of progress you previously made. Chewing that pen literally adds months to your orthodontic sentence.
Wow. That biological reality shifts the perspective entirely. You aren't just breaking metal. You are sabotaging your own cellular biology.
You really are.
Which explains why defensive behavior extends beyond just the dinner table or the office desk. The guide mandates wearing a mouthguard during physical activities and sports.
That's crucial.
Yeah, a stray elbow during a basketball game doesn't just snap the tension system. It can drive all those sharp metal brackets directly into the soft tissue of your lips and cheeks.
And you have to realize that the soft tissues of the mouth are incredibly vascular. Lacerations from orthodontic hardware are severe, and they require immediate emergency dental intervention.
Nobody wants that.
Definitely not.
Yeah.
A mouthguard is basically the bumper system protecting both the hardware and your face.
Right. And the guide also pushes heavily for something I honestly haven't thought about, the travel care kit.
Oh, yeah.
They treat it as an essential everyday carry item. A compact kit containing a soft toothbrush, floss threaders, and a small bottle of mouthwash.
It makes a huge difference.
Yeah, because if you are serious about maintaining that constant tension and keeping the site clean, you can't just leave your tools in your bathroom and hope for the best after a heavy business lunch.
Right. Taking ownership of the daily maintenance is really the only way to ensure the blueprints become a reality on schedule.
Absolutely. But even with perfect home care and an impeccable travel kit, you really cannot navigate a multi-year biological renovation without a top-tier general contractor overseeing the project.
No, you definitely need the pros.
Right, like if you experience that bracket failure, or if you just need your routine adjustments to ensure the bone remodeling is tracking correctly, you need an expert pit crew. So let's look at the practice behind this guide, Omni Dental and Med Spa.
Yeah, the clinical team managing the tension and the overall health of the teeth is the anchor for the entire process.
They are. So they're headquartered at 305 East Rand Road in Arlington Heights, Illinois. And the practice is spearheaded by Dr. Billis Poles, who brings over a decade of hands-on experience spanning general, cosmetic, and emergency dentistry.
Quite a resume.
Definitely. And they act as a massive regional hub. Their service area covers Arlington Heights, Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
Providing access to that level of comprehensive care across such a wide footprint is just crucial, especially when patients are dealing with the unexpected emergencies we just discussed.
Exactly. So we know they handle the complex dental engineering. They offer advanced procedures like all-on-4 dental implants. But looking at the scope of what they do, it reveals a really fascinating shift in how we approach healthcare.
It really does.
Yeah, because they are a fully integrated med spa. Right alongside the root canals and braces, they offer a vast array of aesthetic services. We were talking about Botox, Sculptra, microneedling, permanent makeup, and even IV drip therapy.
It's an incredible lineup.
It is. So what does this all mean? Like, on paper, combining highly advanced surgical dentistry with a med spa sounds like two completely unrelated businesses operating under one roof. What is the overarching philosophy driving that combination?
Well, it really represents a brilliant paradigm shift in advanced patient care, focusing on comprehensive facial aesthetics. Think about it. When a patient invests in something massive, like all-on-4 implants or a multi-year orthodontic journey, they aren't just trying to optimize their bite mechanics.
Right. It's not just about chewing.
They're fundamentally looking to restore their confidence in their appearance.
They want to rebuild the entire house, not just the plumbing.
Exactly. Look at the anatomy. The teeth and the jawbone act as the vital structural support for the lower third of the human face.
True.
So a major smile makeover fundamentally alters the architectural frame of the face. And the skin and muscles, they're basically just the drape over that frame.
Oh, that's an interesting way to picture it.
Right. So why would a clinician meticulously engineer a flawless, structurally sound set of teeth, but completely ignore the fine lines, the volume loss, or the overall dermal health surrounding that new smile? Treating the entire aesthetic ecosystem under one roof makes total clinical sense.
And when you think about the qualifications, a dentist is arguably the ultimate facial specialist.
That is the crucial connection. Dentists and oral surgeons spend years intensely studying the cranial nerves, the vascular systems of the head and neck, and complex facial musculature like the masseters and the temporalis.
They know it better than anyone.
They navigate this high-stakes anatomy daily, administering injections in the tightest possible spaces.
Right, in your mouth.
Right. So from an anatomical perspective, an experienced dentist is perfectly qualified to administer dermal fillers like Sculptra or neurotoxins like Botox. Dr. Pohl's practice can manage the internal biological health of the mouth while simultaneously elevating the external aesthetic confidence using advanced med spa technology.
It's a cohesive, one-stop destination for total facial rejuvenation.
Precisely.
You can address the bone density of your jaw and the cellular health of your skin in the exact same environment. And the source guide also notes that their vibe is deeply patient-centered. Like, they treat a demographic ranging from toddlers coming in for their first checkup all the way to seniors getting complex restorative work, treating them all like family.
Which is so important for easing dental anxiety.
Definitely. They even prioritize environmentally conscious, sustainable practices within the clinic.
It creates an environment where the patient isn't just, a set of teeth on an assembly line. They are invested in the long-term, holistic outcome of the patient's structural health and aesthetic confidence.
Well, we have mapped out a massive amount of territory today. If you take away anything from Dr. Pohl's survival guide, let it be this. Respect the construction site in your mouth. Master the 45-degree angle with a soft brush so you are cleaning the ledges, not just shining the scaffolding.
Is definitely endure the tedious floss threaders.
Oh, yeah. The floss threaders and the micro brooms to protect the contact points from rotting away. Practice defensive eating to maintain that continuous biological tension. Avoid the popcorn kernels, stop chewing on pens, and absolutely carry that travel kit everywhere you go.
A lifesaver.
And when you need oversight for this complex journey, rely on a comprehensive, patient-focused team like Dr. Poles and the crew at Omni Dental and Med Spa in Arlington Heights.
The guide empowers the patient by showing how much their daily habits dictate the speed and success of their own treatment. But connecting the mechanics of braces to the broader comprehensive care offered at Omni Dental raises a truly fascinating concept to think about.
Oh, where does that connection take us?
Well, we discussed how braces rely on constant tension to literally break down and rebuild the jawbone using osteoclasts and osteoblasts, right?
Well, right.
So as your braces slowly and methodically alter the physical bone structure of your jaw over months and years, how might that fundamentally change your actual facial symmetry?
Oh, wow.
Does widening the palate structurally alter your airway space and change the way you breathe while you sleep? When you look at the sheer anatomical power of bone remodeling, it makes you wonder, is orthodontics actually the ultimate original form of deep aesthetic skin and facial treatment?
That reframes the entire ordeal. You aren't just aligning teeth in a row. You are literally sculpting the human face from the foundation outward. That is a brilliant concept to mull over the next time you are staring into the mirror trying to navigate that floss threader behind a wire. Thank you all for joining us on this deep dive. Keep learning, keep asking the big questions, keep protecting that messy, beautiful construction site in your mouth. And whatever you do, do not forget to pack your travel kit.